Hi, I'm Dr. N Shrinivas. I'm a gastroenterologist and hepatologist. I'm practicing in Visakhapatnam and presently associated with Indus Hospitals. I'm going to tell about hepatitis, and I'll give you a brief idea of what is hepatitis, what are the different causes of hepatitis, and how to prevent yourself from getting that hepatitis and how to treat if you get so. So hepatitis, by definition, it means inflammation of the liver. It means swelling of the liver. So what happens when the liver swells? Since the liver swells, there is some damage which occurs to the liver cells, that is called as hepatocytes. When hepatocytes gets damaged, there becomes jaundice. The patient gets jaundice. Jaundice means yellowish discoloration of the eyes. It can be yellowish discoloration of the urine and also yellowish discoloration of the skin. So whenever there is some form of hepatitis, there are many causes of hepatitis, but whenever there is hepatitis, the patient will develop signs of jaundice, and also the other symptoms the patient can have are loss of appetite. He doesn't feel like eating, he doesn't feel like drinking, he'll have a lot of nausea and vomiting, he'll retch, he'll not feel like eating anything and drinking anything. So this process of hepatitis can last for 4 weeks in some cases, and it can be for a very prolonged period, like for almost a year or 2 years in some patients. So hepatitis can occur because of the following conditions. The first and foremost cause is abuse of alcohol. Persons who are taking a lot of alcohol, who doesn't have any limit to the alcohol intake, these are the people who are prone to develop alcoholic hepatitis. The other group of patients who can develop hepatitis are viral hepatitis. When the virus gets into the body, either through infected food material or through infected blood or through infected needles or during hemodialysis or during an operation with infected instruments or infected needles. So there's some viruses can get into the body, and they also cause inflammation and swelling of the liver, and that can give rise to symptoms of hepatitis. So we'll briefly discuss about the viral causes of hepatitis, and we'll limit ourselves to the viral hepatitis causes. Among the viral hepatitis, hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus. 5 commonly existing viruses are present. They are prevalent in India. So we have discussed about the different viruses which can cause hepatitis. Of these, hepatitis A virus and hepatitis E virus, they enter the body because of either contaminated food or contaminated water. So these things happen especially when there is a lot of picnics going on, or when you go out on a function, you eat someplace, especially during the rainy seasons. If these viruses enter the body through infected food or water, they also cause jaundice. But the jaundice caused by these viruses is usually self-limited. In majority of the patients, more than 99% of the patients, the jaundice and the whole disease process, it will settle down in the next 4 to 6 weeks. So hepatitis A and hepatitis E virus, which causes jaundice, it is usually self-limiting. Less than 1% of the patients go into complications of liver failure, which will require additional hospitalization and treatment in the hospital. But majority of the patients of hepatitis A virus and hepatitis E virus, the jaundice settles down in the 4 to 6 week period. Coming to hepatitis B virus and hepatitis C virus. So these are the 2 viruses which enter the body not through the food and water, but through directly contacting of the blood. For example, if you are taking infected blood, or if you have undergone a dialysis, or if you got your tooth extracted, or if you got a tattoo done, especially with infected needles and instruments, these are the situations when the virus can enter the body. The virus can also enter the body through sexual intercourse. If one of the partner is infected, the other partner can get infected because of hepatitis B or hepatitis C. The same way, the virus also enters the body from the mother to the child. So if the mother is an infected lady, this virus can enter the infant during the birth process. So hepatitis B and hepatitis C enters directly into the body through contact of infected instruments, through sexual transmission, and from mother to child. So these are the different modes of transmission. Among hepatitis B, if a young adult gets hepatitis B, the jaundice is usually once again self-limited. More than 95% of the patients clear the virus. There will be some jaundice. The patient will have symptoms for 4 to 6 or 7 week period. At the end of 3 months, majority of the patients, more than 95% of patients who get hepatitis B in their adulthood, they clear the virus. But if the virus enters the body in the early childhood or during childbirth, or if the hepatitis B is not cleared in 5% of the patients, these are the patients who grow into chronic hepatitis. Yeah. So as I was telling, hepatitis B enters the body through infected blood products, infected needles, through sexual transmission, and from mother to child. Majority of the patients who get infection in adulthood clear the virus and they become completely normal. Less than 5% of the patient who get infection in the adulthood, they cannot clear the virus because of low immunity. As also patients who get infected during their childhood or very early period from mother to child, these are the patients who cannot clear the virus. So just because the patient is unable to clear the virus doesn't mean that the patient is having a big disease or is he's having a disease for the lifetime. If the patient cannot clear the virus, he can go into 3 different stages of hepatitis B. Not all patients of hepatitis B are serious or they require treatment. There are 3 stages. One is called an hepatitis B carrier state, the other is called as chronic hepatitis B, and third is called as cirrhosis of liver because of hepatitis B. So if the patient is a carrier, it simply means, as the name implies, he is carrying the virus without any damage being done to the liver at that present moment. So just because he is having hepatitis B surface antigen, lot of patients who come with HBsAg positive doesn't mean that they all are diseased, they don't require the treatment. We'll have to find out whether the liver is getting damaged or not by doing liver function test. So in carriers, though the virus is present, it is present in a very small amount. The number of wire particles are very less. The liver is not damaged actively at that present moment. So what I advise for these people is to regularly get in touch with me, keep doing the liver functions every 3 months to 6 months, and as and when required, we can start the patient on treatment. Carriers do not require treatment, but the family members of the carriers should be screened for hepatitis B. The wife or the spouse should be screened for hepatitis B. If they are negative, they have to be definitely vaccinated. So advice for carrier is to limit their alcohol intake if they are taking, keep a healthy lifestyle, keep your immunity good, vaccinate your spouses and family members and children if they are negative. If they are positive, then we will also treat them accordingly if required. Some patients, after a long time of harboring the virus, they go into chronic hepatitis B. Chronic hepatitis B is, in this stage of the disease, the liver is getting actively damaged, and that is reflected by elevated LFTs. LFTs means liver function test. A lot of people come to me with HBsAg positive. I do an LFT test. The LFTs are elevated. The SGOT and SGPT are the LFTs. They are elevated to more than 2 or 3 times the normal limit. The normal limit is around 40. Less than 40 is supposed to be the normal limit. Any elevation above 80 or 100 is taken as significant. So if a person comes to me with HBsAg positive status, and if the LFTs are showing elevation, then I presume that this particular patient is in a chronic hepatitis state. I advise further investigations to know the viral load and the type of virus it is present in. If the virus is very high and the liver is getting damaged, so these are the patients who require treatment. And third group of patients are cirrhotic patients. These are the patients who are hepatitis B positive for a very long time. They were never treated initially. They were missed when they were in a chronic hepatitis B phase. Now, after a period of 10 to 15 years of chronic hepatitis B, they directly come to me with complete or near complete damage of the liver. So that is an advanced stage of liver disease. So my aim, whenever a patient comes to me, is to find out the stage of the disease. If he is a carrier, I'll counsel him not to get worried about the liver as of now. He'll require regular follow-up. Whenever he develops jaundice or if he develops elevated liver enzymes, which we do every 6 monthly, then we treat him. If a patient directly comes to me in a chronic hepatitis B phase, I start the patient on treatment as soon as possible so that I can prevent him from going from chronic hepatitis to cirrhosis. And if a patient who comes to me with cirrhosis, I look for the complications of cirrhosis like blood vomiting or abdominal distension because of fluid accumulation. I treat for the complications and I also treat for the hepatitis B at that particular instance.